Has your doctor prescribed a warm compress for you for dry eye? In today's video, we'll go over why you would want to do a warm compress, what constitutes a proper warm compress, and then I'll go over my top 5 picks for warm compresses you can use. Welcome to Eye School with Dr. D, where my goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every week. Hi, I'm Dr. D. I'm a doctor of optometry with my own private practice. I'm residency trained in ocular disease and I specialize in dry eye. On this channel, I post educational videos about eye health and vision products. In today's video, we're talking all about warm compresses. So get ready, my peoples, it's time for Eye School. So first, let's talk about why in the world you would do a warm compress in the first place. Well, Meibomian Gland Dysfunction is recognized as contributing to dry eye disease. One 2017 study showed improvements in just about every single dry eye parameter. OSDI scores, which is a subjective measure of your dryness, tear breakup time, staining, and the list goes on, simply with the use of warm compresses for a month, as well as Meibomian gland expression. There have been other studies that show an increased ability to wear contact lenses, even in patients without diagnosed dry eye. Another study showed increased wear time in contact lens wearers with contact lens associated dry eye just by doing warm compresses daily. So what constitutes a proper warm compress? Well, it turns out there's a lot of different ways to do a warm compress, and they're not all equally helpful. Many of my patients have told me they do their warm compresses with a hot washcloth. Unfortunately, that just doesn't stay hot long enough to get the Meibomian glands warmed up to a level that's helpful. What we're looking for is heating of the outside lid and even the inside of the lid up to about 40 to 45 degrees Celsius. That translates to over 104 degrees Fahrenheit. You also need at least 10 minutes of continuous heat. Up to 15, somewhere between that 10 to 15 minute range is adequate. And finally, it's best if you can massage your lids afterwards. Remember, blurred vision after a warm compress is actually a good thing. It means that A, you got that meibum warm enough and runny enough to actually move, and B, did I say A and 2? I love it when I do that. First of all, B, whatever I said. The second point is that then not only is the oil really thin, but then as you massage it, it's moving out of the gland and you're actually increasing the flow of the meibum and getting those glands to be unblocked. And so when your vision is blurry after a warm compress, you can sort of pat yourself on the back because you did some good and you moved that oil out. All right, so knowing that we're looking for the right amount of heat, 40 to 45 degrees Celsius, we're looking for the right amount of time, and then we'd like to know that it worked. So massaging the glands afterward and looking for our vision to be blurred, let's talk about my 5 favorite warm compresses. So the first is tried and true. It's a Bruder mask. Bruder and Optase actually are my first 2, and these are very, very similar. These masks are full of medi beads, or these little beads that are reheatable. You put these in the microwave for anywhere between 20 seconds and 30 seconds. They're very soft. The material in both types of these masks is, what's that called? Antibacterial, basically. So they're very safe to be used over and over. You can gently wash these. You just can't put them through the washing machine, but you can sort of gently spot treat these and use them over and over. Usually they're good for about 6 months with everyday use. Maybe if you're not quite as consistent with your warm compresses, you can make them last longer, but you do want to be replacing these every 6 to 12 months. The main difference between your Bruder mask and your Optase mask, and unfortunately I don't have a Bruder mask to share, but I made a video about those a while back, and I'll link that up above where I have the mask in my hands. But the difference is that the brooder has a connecting piece right here, and the bead bags, that's what I'm gonna call them, they're totally separate from each other, whereas the Optase is actually, you can sort of move the beads all the way to the center. I just like this one maybe a touch better because if you have closer set eyes or further set eyes, you can sort of move these little beads to where they need to be so you can ensure that the heat is really getting to your periorbital region right here. Whereas maybe with the brooder, that's a little bit more difficult because of the spacing between the two eyes, between the eye holes. Next, we've got the Manta Sleep Mask. So I've talked about this in my Christmas gift video. I do love this mask. It's actually not made by a dry eye company or an eye company at all. It's a sleep mask, see? However, upgrade. These little guys have the little beads in them, so you can actually heat these and use a warm compress as you fall asleep. And you can also space them as you need to because there's this little Velcro on the back side. And you can put them on there, get them warm, and put them on your eyes. The big negative for me on these is that there's no beads right here in the center. And so I would just be a little worried that you're not getting heat right there on your lid and maybe not getting it to an even 40 to 45 uniformly across the lid itself. Although it's possible that you could sort of move it so that it was encompassing your eyelid. But it's definitely an option. It's still head and shoulders above a washcloth. So there you go.
Oh,
I don't know why I did that. I don't know. I'm getting silly. I'm sorry. I know, I regretted it immediately. All right, next up we've got a brand new development in hot compresses. Hot off the presses, it's a new hot compress. This is the Tear Restore mask. And this was sent to me by the company to try out. It's definitely a cool concept, different design. This mask this is actually not even the mask. This is just the plastic piece that holds the mask. This is the mask, and this special little disc in here, when it's popped, immediately the whole thing becomes hot. And it stays hot for that good 10 to 15 minute time period. These are excellent. This mask is excellent because you can have your warm compress working and your eyes open. The only thing about that I don't love is that, are you really getting your upper lid warm if your eyeball's open? I just don't know about it. But it is a really cool concept, and a lot of my patients have a hard time getting their warm compresses done in the first place. And so some warm compress is better than no warm compress, and if the only time you can squeeze it into your day is like when you're checking emails on your phone, then again, that's better than nothing, and we can move that oil and get those glands cleared out. So this one you would just put it in here and use the mask. And the positive of this mask, another positive, is that you don't need a microwave. So a lot of my patients don't have a microwave or they travel a lot, and it's really nice to be able to just take a couple of these with you and heat them up immediately. Now the downside is you've got to be able to boil it in a pot of water to reset it. So that can be a little bit challenging, but pros and cons. And maybe you use a brooder or an Optase mask most of the time, and you've got one of these for when you just have to be working on the computer or getting things done. And then finally, another mask option is a USB plug-in mask. So this is another company sent this to me for me to try out. This is USB powered. It can be plugged into any USB. So this is the Mavigel mask, and I love it because it's USB powered and you can take it anywhere with you. You certainly could pack this easily in your carry-on. It's silky, and so it could double as a sleep mask, and the heating on this is relatively uniform, but you'll have to kind of move it to make sure that the heat is concentrated over your eyelids, because I think it's a little more in the center on this. Does it pass our test of, hot enough? I don't 100% know that. But the nice thing is it is continuous heat. So that 10 to 15 minutes of hot compress, it's going to be consistent, continuous heat. And there's also 3 levels, which I like. A lot of my dry eye patients can't take how hot some of the hot compresses get. So this one has 3 different levels to it. And so if you have more sensitive skin or have a hard time tolerating a typical warm compress, there are options when it comes to the USB sleep masks. I know it passes the heat test because the 3 levels, the temperatures on the box, it's 40, 45, and 50 degrees Celsius, or 55 is the highest level. However, I don't know if it transfers that heat effectively to the lids. I don't know if after 10 minutes the lids are 40 to 45. But it's not bad. I think it's a good option. I really do. And finally, these warm compresses are your at-home version of working on your meibomian glands. But there's in-office versions too. I'll link my tear care video up above. I've actually made a couple tear care videos. There is a procedure I can do in my office that is a very uniform amount of heat. It evenly distributes the heat, heats up your glands to 115 degrees for 15 minutes, and then afterwards I can go through and express the glands. And so you may talk to your doctor about an in-office treatment to kickstart your warm compresses, and then select one of these 5 great heat masks to keep your dry eye treatment going at home. Thanks as always for tuning in. I appreciate you guys, and thank you for joining me. Make sure to like and subscribe, hit the bell down below so you never miss a video. Tell me your favorite warm compress in the comments, and I will see you next time. I'm done here.